1. Which is a normal range for an adult's oral temperature? A. 95.5 to 96.5 degrees Fahrenheit. B. 96.8 to 97.5 degrees Fahrenheit. C. 97.6 to 99.6 degrees Fahrenheit. D. 99.6 to 101.5 degrees Fahrenheit. 2. A CNA should report which of the following pulse rates for an adult? A. 72 beats per minute. B. 55 beats per minute. C. 88 beats per minute. D. 90 beats per minute. 3. The most accurate method to measure body temperature is A. Axillary. B. Rectal. C. Oral. D. Tympanic. 4. When measuring respiration, the CNA should A. Ask the resident to breathe deeply. B. Tell the resident they are counting breathing. C. Count immediately after the pulse. D. Count while taking temperature. 5. A systolic blood pressure of 150 millimeters of mercury should be A. Reported to the nurse. B. Recorded as normal. C. Rechecked the next day. D. Ignored unless diastolic is high. 6. When giving perineal care to a female, the CNA should A. Wipe from back to front. B. Use cold water only. C. Wipe from front to back. D. Use one cloth for entire area. 7. A resident with a weak right side should be dressed A. Starting with the left arm. B. Starting with the right arm. C. By the nurse. D. After undressing completely. 8. When shaving a male resident with a safety razor, the CNA should A. Shave against the grain. B. Use alcohol before shaving. C. Shave in the direction of hair growth. D. Skip moisturizing. 9. Oral care for an unconscious resident must include A. Using mouthwash only. B. Turning the head to the side. C. Lying the person flat. D. Giving water to drink. 10. Fingernail care should be provided A. Daily. B. Weekly or as needed. C. Only by family. D. Only by the nurse. 11. Which of the following breaks the chain of infection? A. Wearing jewelry. B. Frequent hand washing. C. Sharing personal items. D. Reusing gloves. 12. The most important time for hand hygiene is A. After you get home. B. After meals. C. Before and after patient contact. D. Once per shift. 13. When removing soiled gloves, the CNA should A. Remove and reuse them. B. Pull from the fingertips. C. Avoid touching the outside of the gloves. D. Wash gloves before removing. 14. Contact precautions require A. Gown and gloves. B. Mask and goggles. C. Surgical cap. D. Shoe covers. 15. Disinfection means A. Sterilizing all instruments. B. Removing all pathogens and spores. C. Using alcohol-based wipes. D. Killing most pathogens. 16. A resident is on a fluid-restricted diet. The CNA should A. Encourage fluids. B. Offer salty foods. C. Track all fluid intake accurately. D. Allow unlimited water at meals. 17. Thickened liquids are given to residents who A. Are dehydrated. B. Cannot digest solids. C. Have swallowing difficulties. D. Are on a low-sugar diet. 18. Output includes A. Food eaten. B. 4 fluids. C. Vomit and urine. D. Oxygen intake. 19. A resident complains of constipation. The CNA should A. Report to the nurse. B. Give a laxative. C. Offer more cheese. D. Ignore the complaint. 20. A normal adult urine output is A. 100 milliliters per day. B. 1,000 to 1,500 milliliters per day. C. 3,000 milliliters per day. D. 300 milliliters per day. 21. The Fowler's position involves A. Lying flat. B. Sitting upright at 45 to 60 degrees. C. Lying on the left side. D. Face down. 22. To prevent pressure ulcers, the CNA should A. Reposition residents every 2 hours. B. Encourage bed rest. C. Use only cotton linens. D. Massage red areas. 23. A transfer belt is used to A. Move heavy equipment. B. Assist with ambulation. C. Apply restraints. D. Replace wheelchairs. 24. When using a walker, the resident should A. Push the walker ahead and run. B. Move the walker first, then step. C. Use it on stairs. D. Hold it with one hand. 25. Passive range of motion exercises are done A. By the resident. B. Only by nurses. C. By the CNA for the resident. D. Once a week. 26. When documenting care, the CNA should A. Use pencil. B. Record facts, not opinions. C. Include personal comments. D. Write before care is given. 27. Which of the following should be reported immediately? A. Warm hands. B. Dry mouth. C. Sudden confusion. D. Refusal to nap. 28. If a resident complains of chest pain, the CNA should A. Call family. B. Report to nurse immediately. C. Get the resident water. D. Check temperature. 29. Reporting is A. Oral communication. B. Written documentation only. C. Optional for CNAs. D. Only for nurses. 30. Objective data includes A. Complaints of pain. B. Temperature reading. C. Sad mood. D. Nausea. 31. The first step if a resident begins to fall is to A. Grab them tightly. B. Try to carry them. C. Gently lower them to the floor. D. Leave and find help. 32. When using a fire extinguisher, the CNA should A. Use the race method. B. Use the pass method. C. Open windows first. D. Move all residents. 33. A CNA finds a resident with a nosebleed. They should A. Lay the person flat. B. Tilt head back. C. Pinch nose and lean forward. D. Apply ice to stomach. 34. If an electrical cord is frayed, the CNA should A. Use it until replaced. B. Report it immediately. C. Tape it down. D. Pull it harder. 35. In case of earthquake or tornado, the CNA should A. Flee the building. B. Seek shelter and protect residents. C. Open all windows. D. Evacuate all patients. 36. A confused resident becomes agitated. The CNA should A. Restrain them. B. Use a calm tone and redirect. C. Leave them alone. D. Argue with them. 37. Depression in the elderly may present as A. Increased appetite. B. Excitability. C. Sleep disturbances. D. Improved memory. 38. Validation therapy involves A. Correcting confused thinking. B. Encouraging discussion of feelings. C. Reality orientation. D. Behavior modification. 39. Residents with Alzheimer's benefit from A. Sudden changes. B. Bright lights and loud noises. C. A consistent routine. D. Long instructions. 40. A CNA should respect residents' rights by A. Limiting choices. B. Ignoring complaints. C. Providing privacy during care. D. Making all decisions. 41. A DNR order means A. Do not remove. B. Do not recover. C. Do not resuscitate. D. Delay nursing response. 42. Palliative care focuses on A. Curing disease. B. Comfort and symptom control. C. Long-term rehab. D. Isolation. 43. Restorative care helps residents A. Become dependent. B. Maintain abilities. C. Avoid exercise. D. Stay in bed. 44. When a resident dies, the CNA should A. Begin CPR. B. Ignore the body. C. Notify the nurse and provide postmortem care. D. Leave immediately. 45. Grieving residents may show A. Joy. B. Denial or anger. C. Physical strength. D. Hunger. 46. A clean catch urine specimen requires A. Catheterization. B. Sterile gloves. C. Midstream collection. D. 24-hour storage. 47. When weighing a resident daily, use A. Different scales. B. Same time and clothes. C. Afternoon weight only. D. Weight in pounds only. 48. A CNA should avoid A. Using a gait belt. B. Offering choices. C. Sharing resident information. D. Assisting with ADLs. 49. A care plan is A. Optional notes. B. Written guide for care. C. Personal opinion. D. Created only by CNAs. 50. The CNA role includes A. Administering medication. B. Diagnosing conditions. C. Assisting with personal care and reporting observations. D. Writing prescriptions. 51. A resident with right-sided weakness from a stroke needs assistance getting dressed. What is the correct procedure for the CNA? A. Dress the left side first, then the right. B. Encourage the resident to dress independently. C. Dress the right side first, then the left. D. Remove clothing from the right side first. 52. When recording a resident's vital signs, the CNA must A. Document in pencil for easy corrections. B. Record immediately after taking them. C. Wait until the end of the shift to document. D. Estimate values based on previous readings. 53. A CNA notices a red area on a resident's lower back. The appropriate action is to A. Massage the area gently. B. Apply a warm compress. C. Turn and reposition the resident. D. Leave it alone unless it breaks open. 54. When performing hand hygiene, which of the following is most important? A. Drying hands on scrubs. B. Rubbing hands for at least 5 seconds. C. Washing under the fingernails. D. Wearing gloves before washing hands. 55. What is the correct action if a resident begins to choke but can still speak and cough? A. Begin abdominal thrusts immediately. B. Encourage the resident to keep coughing. C. Give sips of water to help dislodge the object. D. Call 911 immediately without intervening. 56. When making an occupied bed, the CNA should A. Raise the side rails and ask the resident to roll away. B. Remove both side rails before beginning. C. Ask the resident to stand and wait while the bed is made. D. Complete the task without repositioning the resident. 57. Which of the following is a sign of hypoglycemia that a CNA should report immediately? A. Slow pulse. B. Warm, flushed skin. C. Confusion and shakiness. D. Constipation. 58. Before assisting a resident to ambulate with a gait belt, the CNA must first A. Adjust the resident's footwear. B. Call for a second staff member. C. Measure the resident's blood pressure. D. Loosen the gait belt. 59. A resident is on a fluid-restricted diet. What should the CNA do when offering fluids? A. Offer fluids every 30 minutes. B. Provide fluids only when the resident requests. C. Record and limit the amount of fluid intake. D. Allow unlimited fluids during meals only. CNA Basic Nursing Skills Exam. The CNA Basic Nursing Skills Exam is a critical component of the Certified Nurse Aide certification process. This portion of the test assesses a candidate's ability to perform essential nursing care tasks safely and effectively. It focuses on core competencies such as taking and recording vital signs, assisting with personal hygiene, mobility and nutrition, infection control, proper body mechanics, and recognizing and reporting abnormal observations. The exam typically includes both multiple-choice questions and a hands-on skills evaluation, ensuring that the candidate can demonstrate their knowledge and apply it in real-world clinical scenarios. Mastery of these basic nursing skills is necessary for providing high-quality care and ensuring the comfort, dignity, and safety of patients in various healthcare settings. Here are the top 5 beneficial uses of the sample exam. 1. Demonstrates clinical readiness. The exam validates that a CNA possesses the essential hands-on skills and knowledge needed to safely care for patients in real healthcare settings. 2. Supports certification requirements. Passing the basic nursing skills section is a mandatory part of becoming a certified nurse aide, enabling employment in hospitals, nursing homes, and long-term care facilities. 3. Enhances patient safety and care quality. By assessing a candidate's ability to correctly perform vital tasks like hygiene, mobility, and monitoring, the exam helps ensure consistent and high-quality patient care. 4. Strengthens professional confidence. Successfully completing the exam boosts CNA's confidence in handling daily responsibilities and making accurate clinical observations. 5. Serves as a foundation for advancement. The skills assessed form the basis for further healthcare education and can prepare CNAs for roles such as LPN or RN.